Dear viewers, welcome you all to our show, Orthopedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing mask and keeping distance with each other. Dear viewers, today our topic is a magical topic that is Ilizarof, the ultimate destiny of all orthopedic surgeons. And our episode one topic is the biomechanics of the Ilizarof. And our honorable speaker is the very known, the pioneer Elizare surgeon in Bangladesh, Professor Mafakkarul Bari sir, visiting Professor Bardem BIHS, and visiting honored Professor Kurgan, Russia. Sir, welcome to our show, Orthopedic Solution Academy.
Thank you so much, Tanveer, for your good introduction.
Thank you very much, sir. And we have an excellent academic expert from Russian Institute of Ilizarof, that is Professor Novikov, sir. And I would like to welcome our very popular professor, Professor Novikov, sir, to our program, Orthopedic Solution Academy. Sir, welcome to our show, Orthopedic Solution Academy.
Good afternoon, all of doctors from Bangladesh.
Thank you very much, sir. Dear viewers, we all know that the Ilizarof is a Russian method, and it is an excellent method. Nowadays, we are doing lots of Ilizarof in our country, but a few years ago, it was not possible. But only Professor Mafakkarul Bari sir inspired us to do this Ilizarof, and now many young surgeons are doing Ilizarofs all over Bangladesh. Now, I would like to request our honorable speaker, Professor Mafakkarul Bari sir, to start his presentation regarding the biomechanics of Ilizarof. Professor Mafakkarul Bari sir, please.
Thank you. Can you hear me?
Yes, sir.
Yes.
We can hear you clearly and loudly, sir.
Okay. Thank you, Tanveer, for your good introduction, and Professor Novikov, my good friend who is from Kurgan Center. I am very much glad that he's with me. And today I'd like to share my experience of the Ilizarof technique. And Ilizarof is my life, Before starting the biomechanics, I'd like to talk a little bit regarding the past, present, and future methodology of Ilizarof. So, this is my institute where I worked more than 10 years. And this is one of the biggest centers in the world, orthopedic and trauma, situated in Dhaka, our capital city. This is my private center. This is I myself in Kurgan. You can see these are two guest honored professors of the Kurgan Center. And Kurgan is location from Moscow, 3,000 kilometers. You can see in the picture. And this is Professor Ilizarof, who has established the powerful technology for the management of a great variety of bone disease and conditions. It is considered by us as a system that is based on biological laws and technological philosophy. Basic principles of philosophy were started by founder of this method, Professor Ilizarof, talk about the tension stress effect that stimulates biosynthetic activities in tissues, adequacy of blood supply and loading, gradual lengthening and correction, possibility of full-time control of callus formation, and early limb function and loading. The magician of Kurgan, where he started working in Kurgan, that is, I told you earlier, 3,000 kilometers from Moscow. Professor Elizar is a Russian orthopedician. He is the Russian Academy of Medical Science, inventor of his apparatus, Elizarov apparatus. The institute is called the Russian Ilizarof Scientific Center, Restorative Traumatology and Orthopedic. And this is called the capital of the orthopedics in the world today. And this is Professor Ilizarof, born in 1921 and passed in 1992. Academician. There are two academicians in Kurgan, one Professor Shevtsov, disciple of Ilizarof, and Professor Ilizarof himself. You can see here, he graduated in 1943 and he started working after the Second World War in 1952, invented the transosseous compression distraction osteosynthesis. So in 1968, he did his PhD thesis, and at the same time, the thesis was accepted for the DSc, Doctor of Science. So this is transosseous compression distraction osteosynthesis, with authors apparatus, experimental and clinical investigations. 1969, he got the DSC, and in 1970, you can see he did organized a symposium which was held in Kurgan with all Soviet traumatologists and orthopedicians regarding his transosseous compression, distraction, osteosynthesis. These are the some pictures of the musicians of the Kurgan. In 1976, he arranged a conference in the Kurgan regarding his transosseous osteosynthesis. You can see, and in 1983, he went to Italy to talk about his invention. In 1985, the Asami was found in France, in Belgium, Portugal, Mexico, and Yugoslavia. Nowadays, more than 65 countries has got the Asami, including my country, Bangladesh. So Professor Ilizarof, he lived for 71 years, worked with this method 40 years, and he worked in Kurgan Center for 21 years. You can see the picture of the left side with Professor Dror Pale, and at the same time Professor Shevtsov with Ilizarof. And in 1992, Springer Verlag, Berlin, they have written a book which was the pictures were given by the Professor Ilizarof, 8,000 cases, 656 pictures with 3,100 illustrations. So this is the awards the Professor Ilizarof was awarded by the different organizations of the Russia and outside the Russia. So this is Professor, some pictures of the professors Ilizarof. So this is the Professor Ilizarof's daughter, Dr. Sivitlana. I met him in Miami in 2015, and the son, right side, the Professor Alexander, son of the Professor Ilizarof. You know, the Professor Ilizarof was called the Michelangelo of orthopedics. You can see Shevchenkivich and Mauri with Ilizarof. The method is spread to Italy after he successfully treated Italian journalist Carlo Mauri in 1980. The extraordinary theory and principles he developed for the treatment of bone are of even greater significance than his instrumentation and devices. This was told by the Stephen Parrott, a paragon of ingenuity in Jury 24. So Ilizarof, this is the, if you see the right side, this is the old model in 1952, which was invented by the Professor Gabriel Abramovich Ilizarof. So a few moments now, you can see this is the graveyard of Ilizarof, who died in 1921 and who died in 1992 and was born in 1921. What are the contributions of the Ilizarof? This is very important. First, biological law of tension and stress. This is slow and steady traction on a given tissue creates a distraction, and which stimulates histoneogenesis. And biologically, this is very important for application of the Ilizarof apparatus. And second biological law, the shape-forming processes acting upon bone tissues are dependent upon the magnitude of the applied load and the adequacy of the blood supply. And method of corticotomy, how you can do the corticotomy for lengthening the any kind of deformity correction. If you go for corticotomy, that was also invented by Professor Ilizarof. And of course, the distraction and compression, osteogenesis, and lots of instruments, myriads of instruments, thousands of instruments, more than 700 configurations you could make by this Ilizarof apparatus. So the procedure, the first apparatus Ilizarof designed for it was inspired by the shaft bow. You can see here harness and a horse carriage. Originally, bicycle parts were used for the frame. Horse in harness with the shaft bow, decorated arch standing behind the horse's head. So you can see the car was used by the Professor Ilizarof. This is now kept in the Ilizarof Center. And in the right side, the then director who served the Ilizarof Center for more than 10 years. Now, Professor Gubin is the director of the Central Institute of Traumatology and Orthopedics in Moscow. This is the total view. You can see 850 beds, 18 departments, 24 operation theaters, more than 350 orthopedic surgeons and employees, and other ancillary personnel. Now, this is, you can see the orthopedic capital of the world. See the Russian Ilizarof Scientific Center, the orthopedic center in the world, which is called the orthopedic capital. Now, whenever you can see the during snowfall, front gate of the Ilizarof Center, you can see this is fully covered, and the summer season, beautiful flowers, and the right side, the director and other staffs of the hospital, other doctors of the hospital. So this is the Elizarov Museum, was opened in 15 June 1993. Professor V.I. Shevtsov, director of the center at that time, opened it during the International Scientific and Practical Conference. The Elizarov method, achievements and prospects that were dedicated to Gabriel Abramovich Elizarov and the future of the method. You can see here, this is a part of a museum that I'm showing you. The professor, disciple of the Professor Elizarov Shevtsov, who came to my country more than 8 times, and he's the mentor. He's my professor. I learned a lot of things from this gentleman. And right side, Professor Shevtsov, and left side is dean and director Alexander Vadimovich Gubin. So the Gubin Alexander Vadimovich, former director, who came to Dhaka, you see in my center in the right side. And this is I myself with my spouse in Kurgan Center. So new director now is working, Dr. Bursov, Alexander Vladimirovich, who has taken the charge from 11th February 2020. So this is, you see, the Animal Experimental Center in Kurgan, Russia. 2019, I visited, I have seen the 390 dogs, 390 animals, not dogs, in total, everything I've seen there in 2019. So, see how they can do the applying the Ilizarof in the animal trauma in Russian Ilizarof Center. So today, Ilizarof and in future, extensive injuries, road traffic injury, industrial trauma, war injuries, and infection are the leading problems in trauma and orthopedic surgeons in future. Ilizarof is supposed to be adjustable to the large scope of injuries and congenital deformities to give absolute stability, enable movement of the adjacent joints and bearing the full load, safe for the patient to have low scope of complications. With the development of medical science, metallurgy, technology, electronics, we can expect improvement in the field of Ilizarof Center, Ilizarof. So this is during my student life, you can see, that is near about 40 years back. I was at that time in Kiev, and this is, I was working with my colleagues in Kurgan, OT. They have a dog square. They're serving as a scientific research work. And the stalwarts of the Ilizarof technique in the world. Right side, you can see Harjat Bar. This is Oganisyan, Indian Junjunwala professor. And these are the well-known Ilizarof stalwarts in the world. So stalwarts of the Ilizarof that we met in 2016 in Australia in Brisbane. You can see here all the renowned orthopedic Ilizarof surgeons in the world. And Ilizarof Day, 15 June. A message, all of us should try to visit the RIC RTO in Kurgan once in a life. This is the property of the whole world, and our task is to promote it. The man who made it possible, this is the great scientist, talented doctor, that was written in Russian, I have translated in English, and gifted innovator, creator of the apparatus, and he is the sole authority of the transosseous osteosynthesis, academician, Russian Academy of Medical Sciences, Professor Gabriel Abramovich Ilizarof. Those who have gone to the Ilizarof Center, we stand on Ilizarov's shoulder and will continue our effort. See, the left hand, Professor Ilizarof statue is holding the Ilizarof apparatus. A physician must observe nature, learn from it, and to be able to rectify its flaw. Gabriel Abramovich, they told that one. And see, my dream to visit Ilizarof Center since my residency, and today in my country, we are doing a lot of cases. We have a lot of young Ilizarof surgeons coming out. And with these infinite variations, it can be used in many clinical settings frequently when nothing else can be done. Its utility is limited only by our imagination, or rather by the lack of it. Now I would like to talk something regarding the biomechanics of the Ilizarof compression destruction device. You can see, you can put your Ilizarof apparatus from head to toes. The dancing Ilizarof. And Professor Ilizarof, when he was young, he was trying how to help the people by creating the apparatus with the Elizare Fixator. Now see, he has given this authority after creating this Elizare apparatus in 1952. What is the Elizare Fixator? Classically, this is circumferential. We can use the small diameter wires, 1.5, 1.8, and 2 mm, and these wires are all smooth and tensioned, elastic. And another time we can use the hybrid. But classical Ilizarof apparatus, we are using all time with the wires. And what is optimal stability? You can see here how the horses in harness with a shaft bow, decorated arch standing behind the horse's head. And on the basis of that, he created this his ring apparatus. What is the stable? What is the optimal stability, and how to ensure the optimal stability? For this, there are types of things in the Ilizarof apparatus. That is the rings, very important, wires, very important, and tension. How to apply the tension with the tensioner, and internal stability of the bone. And modes of Ilizarof external fixation. There are three basic biomechanical modes to Ilizarof external fixation. We can apply compression, that is, we can make it less, and we can go for distraction, we can lengthen, and we can go for neutralization. Modes of Ilizarof external fixation. The compression mode is used for joint arthrodesis or simple fractures to impart stability to bone ends. If you look at this right side picture of the X-ray, you can see the distraction mode used for osteogenesis or calotesis for limb lengthening as well as for ligamentotaxis to provide stability to intra-articular fragments. If the fracture is highly comminuted, then a neutralization mode is used to prevent limb shortening at the bone area. Stability of any external fixator constructs, we can see there are different types of external fixators: monolateral, bilateral, and Ilizarof, and we are telling it circular. In monolateral constructs, only the half pins are used in a cantilever mode. In bilateral constructs, combination of the half pins and transfixator wires are used. And in Elizare Fixator constructs, we can use all types of wires. And if you use pins, then it will get a hybrid combination. Now, regarding the optimal stability, this is very important. Stability, it doesn't mean rigidity. Rigidity doesn't mean undesirable stability. Desirable stability means you can control and you have got the axial micromotion. And in Ilizarof apparatus, axial micromotion is very important. Whenever you are talking about the undesirable stability, it means you are getting angular bending and you are getting shearing movement. That means side to side movement of the two fragments. And at the same time, you can get the rotation or torsion. That means rotational movements of the fragments. So this is the optimal stability. Now, what do you mean by stability spectrum? You can get primary union or you can get secondary union. If it is unstable, then you will get hypertrophic non-union and loosening, and at the same time, you will get the infection. For primary union, you can get non-union, delayed union, and stress shielding. Now, regarding the uniplanar fixator, if you compare the uniplanar with the multiplanar, Ilizarof is always multiplanar. If you look at this perpendicular, if you uniplanar fixator fixed like this way, what will happen? And this is perpendicularly, and this is axially. If you compare the left one, middle one, and right one, uniplanar is not a stable fixator, but stability in plane of fixator, always in uniplanar, you will get a cantilever effect. If you look at this picture, uniplanar fixator, this is your fracture area, two fragments, and cantilever loading. Cantilever structure is one which is supported at only one end. And beam loading, look at the right side picture, a beam loading structure is supported at both ends. Here, you can get minimal shearing, axial movements with bending. You can see the picture, this one, red one, and uniplanar and bilateral and bending moments very minimized and axial moments minimized in case of this type of plane of fixator. Now regarding the stability, 90-degree to fixator plane, look at this right side. Bending moment much less here. You'll get some shearing moment and axial moment is very negligible. But if you think about the delta frame, two sides, this is perpendicular from the right side, on the lateral side perpendicular, two uniplanar fixator, this one and this one, each cancels out the other instability and axial moment is prevented. You will not get any axial moment here. This is very stiff, which you can get non-union by this fixator. And dynamic uniplanar fixator, uniaxial, that we are getting orthofix. Axially unstable by design. This is, you can control yourself, stable to bending, rotation, and you can get some shearing forces here. Regarding the Ilizarof and other fixators, linear versus non-linear stiffness. You see here, linear Ilizarof carving here. In other fixator, you're not carved here. That is linear versus non-linear stiffness. You can compare with this apparatus, with Ilizarof apparatus and other apparatus. Now, why Ilizarof more stable than other fixators? If you think about the other fixators, uniaxial, biaxial, aspatial, or other fixators, this is I-beam, 4-point fixation. Your wire is going from this side to this side. These two wires you use, you are fixing 4 points. This is circumferential. You can hold the bone from all sides, goes up and down whenever you can go. You can apply the compression, you can go the destruction, and axial stability very much less. This is very important and allows better axial micromotion. Bending stability equal or more. If you want to bend this one, torsional stability equal or more, and shearing stability also equal or more. Biomechanically, this is very much stable than other all fixator. This is scientifically proved. That's why Ilizarof compression destruction device gives more stable fixation than other apparatus. What is axial micromotion? Micro and macro. Probably less than 1 millimeter displacement at maximum load you can get in 1 millimeter. Think yourself, this is very less, and you'll get excellent osteogenic response with Ilizarof apparatus. Distraction, compression apparatus, stability variables. What you need? You can think wire, diameter, how much tension you are applying, and you can use the drop wires. The wire that is away from the ring, 1.5, 1.8, and 2, and ring size, types of the rings, and offset of bonding, and connections, number of and positions, and bone quality. It gives a good result, and you'll get a good, fantastic result if your bone quality is good. Span of bone head, fracture geometry, you should have to know that one, and interfragmentary compression, how we can apply. And the advantages of Ilizarof fixation wire, great advantage to a beam loading with tension wire implant is the adjustability of the wire tension to customize the strength of the implant. And varying amounts of tension can be used to support different loads in different parts of the bone. Ilizarof wire tensioning, why? You see, if you look at this picture, we are using almost 1.8 mm wire, then you can apply the 150 mm ring. Then here, the right side, at this side, you can apply 80 to 130 kg of the weight with the dynamometer. And if you think about the wire tensioning, elastic deformation you should have to know, plastic deformation you should have to know, and yield point. Yield point 120 kg per square millimeter. 1.5, if you use 1.5 wire, then you'll cover this one 1.76 mm. And if you use 1.8, you'll cover the area 2.5 2.54 mm. And if you use the 2 mm wire, you will cover the 2.7 mm. Here you can see yield point. If you go beyond that limit, then you will break the wire. So this is the load and this is the length. So Ilizarof manual tensioning. Tension we can apply 80 to 130 kg. If you apply the dynamometer, you can see how much weight you are applying in the wire. So carry home message for tensioning. Tension wire stability 90 to 130 kg with a dynamic tensiometer that I told you earlier. Here you see how we are applying the dynamometer. Manual tensioning by Russian technique. In emergency case, even in normal case, the Russians they are using, but it's better to use the dynamometer. Exactly, you can see how much force you are applying around the ring. So stability regarding 1990 very good, but 1990 you cannot do for the anatomical constraint everywhere. 45 130 you can do like this, and you can do like this, and tested configuration of the Ilizarof apparatus. So stability, Ilizarof wire, K wire factors, drop wire you can see here, olive wire you can see. If you want to do a good correction, you see here right side ankle fracture by millular fracture, how we can easily correct with the drop wire and olive wires. So transverse olive wires are, you can see here, this is your fracture. You can put the olive wires like this or from the left side, and this is opposite side, or you can go like this, you can do like this. Here are three varieties of the picture. You can see transverse olive wires application. So bend wire technique, how you can correct with bending wire technique. This is also is very important for biomechanics. You should have to think yourself. The half pin we are using, this is the chance half pins in anatomical constraints in the upper femur, that is a proximal femur. You can apply this type of half pins, and you can apply the wires. You can see the tension of the wires and half pins, and how to put the half pins and the wires. These are the shunts. Pre-drilling is necessary. Increase diameter 4.5, 5.5, and 6 mm. Biomechanically hybrid frame, laser stable. I-beam is lost. This is biomechanically, I told you already. Stability of an external fixator construct. Half pins should not be placed too close to the joint capsule or fracture hematoma. Wires are half pin further apart, and each ring level will increase the level of the Elizare external fixator. Now, dear friends, you can see the Elizare stability bone factors. Here, three pictures you can see. Drop wire, drop wire, drop wire. Ideally, one ring, drop wire, and drop wire. This is one. This is another variety of ring, drop wire, and drop wire. You can see. This is less stable, drop wire, one ring, and two rings. So two rings is always stable. You are getting bending shear stability as wide as possible. Osteoporotic bone, thermal necrosis, loss of tension. You should have to think yourself when you are applying the Ilizarof apparatus. This is how you can put the Ilizarof apparatus. Basic idea, basic principle. If you know the philosophy and principle, the Ilizarof application in the OT or in preoperative ring size, you should have to keep in your mind how much will be your kick. This is the measurement of the ring, you see, template. When you are expert, you can see by looking your eyes what will be the size of the ring. Starting from in my country, 60 mm to 220. It depends for the pediatric, the children, 60, 80, 90. And this is the preparation of the OT for Ilizarof surgery. You can see here, patient is lying. This is the trolley, how you can manage the patient with different varieties of Ilizarof apparatus. So OT preparation, you can see here, leg standing in the OT, an operating room table which accommodates all necessary trays for Ilizarof application. These are the myriads of apparatus. Before applying Ilizarof, you must keep in your mind that I have a lot of apparatus, so that you can use these apparatus will give you thinking. Your mind will be on patient's leg or head Whenever you'll see you have a lot of different apparatus, you can apply, you can think yourself, how can regulate everything. This is before surgery, you must have lot of instruments in the OT. And this rubber stopper, you see, you should apply two types of rubber stopper. When you are using the olive, this is the unit cutting, so that you can identify before dismounting, remove the apparatus. This is your normal wear or olive wear. These are the simple half pin cutters and olive wire cutters and operation OT for Ilizarof surgery. Dear friends, I would like to tell you the Ilizarof is not very much difficult to learn, only meticulous intelligent study. And if you follow up the patient, if you know the safe corridor, how to put the wires, it gives fantastic outcome, fantastic results. And these are the transosseous wire insertion tensioning method. Sequentially, you go for that. Even you can see after this is when I was working in Kurgan. You see plastic surgery combination with the Ilizarof surgery. These are the very beautiful things so that you can apply Ilizarof even in plastic surgery patients. Rehabilitation fundamental principle I told you is load and motion. It's very important. This is the rehabilitation activities of the Ilizarof apparatus. Stop sharing. Okay. Okay. One second. Something is going on. This is, you see, my different patients in different locations of the applications of Ilizarof.
Sorry, sir.
Okay.
We cannot see your screen, sir.
Now, one minute. This is
No,
very
sir.
important screen. You can.
No, sir. We can't.
You can't.
No.
Wait. Anyway, you don't see. Huh? So, this is almost near about finishing. I'm going to, but something wrong here. Hello.
Okay, sir. Would you like to finish your presentation right now?
Now, can you see this one picture?
No, sir. Yet not.
One second. You're not very good picture now. This. This is slow, very slow now. Tanvir, you have time? 2 minutes?
Yes, sir. No problem. We can wait for you, sir.
Okay. Hmm?
Dear viewers, we are waiting for our honorable speaker, Professor Fakhrul Bari, sir. He is now disconnected, but trying to reconnect with us. And I think he can manage his connection yet. Uh, yes, Professor Fakhrul Bari, sir, is on his screen now. We can see him, and I hope we will listen from him again. Is
Uh,
it okay?
1 minute,
Yeah.
1 minute. Yeah, we still time. There's time, eh?
Yeah.
10
Yes,
minutes.
sir.
I mean, okay, okay. There is Chrome has crashed. You know, Chrome is disturbing.
Yes.
1 minute, 1 minute. I can show you. Mhm. This is the problem of the science. Yes. Yes. Not 12. Mhm. Okay. Now, can you see this?
Yeah, we can see the screen, sir.
1 minute, 1 minute. I'm going fast. Front. I'm going fast. I'm going fast. Ah. Mhm. Now you can see this one.
Yes, sir.
Yes.
The rehab
So
activities, yeah.
yeah, see. So I always back, back to that. Uh, 1 minute. It is 30 seconds. Give me 30 seconds. Back to the Intact to Tanvi to ইয়ে হয়ে গেছে এখন দেখাচ্ছি 1 minute. Okay. Stop sharing. So can you see this?
Yes, sir. We can see you. The screen is. I convey my gratitude towards the slide. We can see. Do you need any more time, sir, or we can continue our discussion?
Maybe this part of your presentation we can see next time.
Yes, sir. Yeah, I think so also. Um, Dear viewers, due to some connectivity problem, we are facing these sorts of problems. Hope we overcome these problems and will reconnect with our honorable academic panel and speaker. Now, I would like to share something regarding the Ilizarof. This is a very important topic, Ilizarof, and we are doing the Ilizarof in NATO and as well as in other medical college hospitals. And not for the ultimate destiny, but now we are doing it in a primary case. Usually, in case of open fracture, in case of non-linear infected and some sort of deformity corrections. So we are doing the Ilizarof. We are facing the internet problem a lot. As we're telling about the Ilizarof, that we're doing the Ilizarof in our medical college, such as in Namching Medical College, Rangpur Medical College, and even in Kushtia Medical College, and as well as in NITO, that is the National Institute of
Colleagues, I lost you. I cannot see you.
Somebody, sir, please unmute.
Professor Novikov, sir. Can you hear me? Novikov, sir, can you hear me?
Yeah, I listen to you. Yeah, I heard you.
Okay. Professor Barisar is trying to reconnect with us, and I think we can discuss regarding our topic, the biomechanics of Ilizarof. Now, I would like to request you to share your knowledge regarding your the biomechanics of Ilizarof with us, and definitely with the young Ilizarof surgeon of Bangladesh. Sir, I would like to request you to share your very valuable knowledge with us.
If we talk about Ilizarof frame, like any methods, young doctor needs start work with expert surgeon, because excellent presentation just now showed Professor Barry, but we cannot explain clear how we to do tension, how we can put frame, which kind of position better. This is only experience, hand by hand, face to face, surgeon to surgeon. We can shift our experience to young surgeon. But this is like music. If any young surgeon will feel possibilities in these magic methods, you can see how can help Ilizarof technique, Ilizarof philosophy get us from any complication, from any difficulties. For example, yesterday I operate
young girl from central of Russia. Simple fracture, but open fracture, forearm, both of bones, ulna and radius. Twice she was operated in Moscow in our Central Trauma Institute. After each surgery, very soon come deformity of forearm, and then doctor closed growth line, and she come for us with severe deformity of for forearm. Twice she operated with another osteosynthesis. Just now, outside fixator, Elizare Fixator, give us possibilities lengthening and equalized size of both of bone. And for me, more easy will answer for your questions. If you have any questions, please just now give me, and I will answer. And our knowledge with biomechanics, we get step by step. And maybe just now, this is sometimes a little bit difficult for understanding, but this is like, I want to repeat again, like music, very easy when you start use. From simple to difficult, but each day. During my experience, near the 40 years, 39 years, I use only one technique, Ilizarof technique. And so many times I try use another plates, intramedullary nail, and immediately I have not difficulties, I have severe complications and go away only with our helper with Ilizarof frame. Without knowledge about biomechanical, all of our alphabet principles of Ilizarof methods, all time surgeon get problems and complications. But our methods, when we understand, when we follow all of rules about Ilizarof techniques, this is magic situation when doctor go to the area free of complications. Free. Never come problems if surgeon follow rules and law of Ilizarof principles. Colleagues, did you hear me?
Yeah. Yes, sir. Yes, sir. That's great, sir. We have to follow the principles and rules always to get the success. Sir, I have a question. Is there any rules to insert the wires? We have to maintain any angle during inserting the Ilizarof wires?
Yeah, of course. Next Friday, we will talk about a safe area and some techniques of how we need pass the wires. I try my best on the next presentation. I will show, because Dr. Barry explained about this, and many complications come from this point when, for example, doctor start pass wires in the diaphysis and without stop, without put on some cool liquid, come in situation when end of wire cook, burn bone, then come in necrosis this area, then come in some inflammations, then come in osteomyelitis, and this is from beginning, fault of doctor. This reason why better pass wire and see how pass wire experience doctor, old doctor, step by step with rest, with respect for soft tissue, because if you will pass wire without follow interest of soft tissue, immediately will come some difficulties after surgery. And why we use wire? Because wire so elastic and so strong. And when after surgery patients start use legs or upper extremities, wires give possibilities for bone to breathe. And first, when you pass wire, we fix very strong fixed bone. But with same situation, wire give possibilities, little bit change size of bone, and with weight bearing, bone can breathe.
Okay, thank you very much, sir, for sharing your knowledge with us. And we have our Professor Mufakarul Bari, sir, with our program Orthopedic Solution Academy again. So welcome back. I think you're okay now. Your connection is okay now.
Another laptop. My one is 60% is restarting working. So I have entered another laptop. So almost I was in the ending of the my lecture, and I could not show you some beautiful slides. So this is okay. Now I could not follow the questions and answers of the Novikov professor. So any questions you can ask me, or Professor Novikov can add anything. Thank you very much for giving me the time that I have not taken too much time, but we have started late, 25 minutes late. Okay. And the program was good, I think so. I don't know. What is the comment of Professor Novikov, please? Tanvir, you can ask.
Yes, sir. We have already asked Professor Novikov, sir, and he shared his knowledge regarding the wire passing, and he told us that in the next Friday he will discuss regarding this matter. We hope for the best. And Professor Novikov, sir, do you have any questions to our Professor Mufakarul Bari, sir, regarding this presentation?
No, I want only say, let me say, thank you very much for this information, because I can say Dr. Bari, our ambassador in the world, this is a great person who gives so many excellent, perfect information about Russian technique. And I am very expressed, thank you, because very strange, just now foreign doctor, like Dr. Bari, like Inaze, Dr. Arshad from India, Dr. Hosni from Egypt, Dr. Raouf from Iran, Dr. Kivrienko from Italy, return our technique back to the Russia, because very strange. Just now, Ilizarof technique use, this is true, not so many doctors. Why? Because in Russia coming vast of system for treatment, when chief of hospital very strictly check time of treatment, quickly, next, because money is honey. And Ilizarof technique, not so quickly. And when we talk about perfect result, we cannot get quickly. We cannot get during few days. Our technique for doctor who can who already spend time for patient. And with a person like Barry, just now step by step Ilizarof methods back to the home, to the Russia. I want to say again, thank you very much, and I want share my experience with the doctor from Bangladesh.
Thank you very much, sir. I hope we will learn many things in the coming Friday from Professor Novikov sir regarding the Ilizarof. And now I would like to thank our honorable speaker, Professor Mofakhtarul sir, for his brilliant presentation. And he is the pioneer Ilizarof surgeon in Bangladesh, and he is the ideal of Ilizarof in Bangladesh. So I would like to give him a salute from Orthopedic Solution Academy for being with us, and we are very much proud to have Professor Novikov sir with us, and it's a great pleasure for us, and definitely a great honor for all orthopedic surgeons of Bangladesh. And I would like to give thanks to Professor Novikov sir and Professor Mofakhtarul Bari sir from Orthopedic Solution Academy and from Raj TV. So thank you very much for being with us, and I hope we will see you in the next Friday with another magnificent topic. And I would like to thank Raj TV and definitely our sponsor, Renata Pharmaceuticals Limited, for sponsoring this program. And now I would like to give a special thanks to our viewers. And dear viewers, please stay tuned with us and stay tuned with Raj TV so that you can get the latest information regarding the Ilizarof. And I'm Dr. Mohammad Tanvir Ashraf saying bye-bye to you for today, and hope we'll see you in the next Friday with another magical Ilizarof topic. Till then, bye-bye.
Bye-bye.
You are
Thank you.
watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.